Good evening, and thank you for joining us for this virtual community town hall. During this town hall, you will hear from our expert panel, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Doman, Chief Nursing Officer. And third, our panelist is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer. Thank you all for joining us tonight. And Dr. McDermott, I'd like to turn it over to you to start our program and tell our viewers the latest information happening with COVID-19 in our region.
Thank you, Lisa. And thank you everybody for taking a few minutes out of your evening to join us for our Facebook town hall with the community. It's been a few weeks since we last got together, and we wanted to get together to bring you up to speed with some of the trends that we're seeing here locally with COVID-19. Also talk a little bit about the vaccines and the vaccination efforts that are going on. I've heard lots of questions about that in the community, and we thought it'd be great to get together again, have a town hall, share some of that information and answer your questions. So I'll start talking about what we're seeing with hospitalized patients for COVID-19 and share with you some of our data. Currently, we have 22 inpatients who are hospitalized with COVID-19 that need inpatient treatment between Mary Washington Hospital and Stafford Hospital. The trend lines there on the graph, you'll remember it was just a few weeks ago, we were up at about 100 patients but at Mary Washington Hospital and Stafford Hospital. So the trend lines since really the middle of January until now have been pretty fantastic. We talked about flattening the curve. We didn't just flatten the curve, we turned the curve, right? And those curves are heading in a very, very good direction. Superimposed on top of the yellow line there on the graph, which is our experience, is the orange line. That's the state experience with inpatients around the state. You can see it mirrors our experience almost perfectly. And the state has also seen a dramatic decline in inpatients hospitalized with COVID-19 throughout the Commonwealth of Virginia. You could take these same graphs, and they're the same graphs I think that everybody's seeing around the country, a significant decline, negative trends with inpatient hospitalizations. That's a fantastic thing. It's probably a combination of multiple efforts, but certainly one of the big things is the vaccines that have become available. And we now have a lot of vaccinated individuals that are breaking the chain of transmission of COVID-19 in our communities and across the country. And that's fantastic news. And we know all of these vaccines are very, very effective at preventing severe disease with COVID-19. Nobody in any of the vaccine trials was hospitalized or died of COVID-19, which is just amazing. All of these vaccines are fantastic. Here locally, we have administered at the end of the night tonight over 74,000 vaccine doses that we will have administered to our community through our vaccination efforts at Mary Washington Healthcare. And over the last several months of running our fix center operation really at full speed just about every single day. And so we're proud to offer that to our community. We want to play that role in getting our community vaccinated. It meets our mission to improve the health of the people and the communities we serve. It's what we're all about here. There's no better way we can do that now than to take every bit of vaccine that we can get our hands on for our community and get it into individuals in our community to protect them. Across the state, over 2.4 million vaccine doses have been administered, and that's pretty incredible. I think it's 19% of the population of the Virginia now that's had at least one dose of a vaccine, which is just great. The vaccine, it looks like the forecast for those, there's going to be more availability, more production happening, and as that production occurs and it gets distributed to us here in Fredericksburg, we're going to keep running our vaccine clinic and getting our community vaccinated. So very, very proud of the efforts of the team that have put together our Fix Center vaccination center for COVID-19 and the fantastic work that they're doing every single day here in our community to make our community safer and protect our community.
Thank you, Dr. McDermott. And can you talk a little bit about the types of vaccines that have been available through our clinic?
I can. So there have been 3 vaccines now that have been approved with emergency use authorization from the FDA. And those include the Pfizer vaccine, which was the first to receive its emergency use authorization. It was followed very closely with the Moderna vaccine. And then just very recently, the Johnson & Johnson vaccine has also received approval. The Johnson & Johnson vaccine is a 1-dose vaccine. The Moderna and Pfizer vaccines were studied with 2 doses, so that's how they're currently being administered. But like I said, lots of questions about which one of those vaccines is best, right? And my answer to that is they're all the best, right? And I measure that because in all of those trials, nobody who received one of those COVID vaccines was hospitalized or died of COVID. That's the ultimate endpoint, right? They're very, very protective and very effective at preventing hospitalization and death. And so when people say to me, gosh, if I'm not vaccinated and I'm being offered one of these vaccines tomorrow, should I take it? And the answer to that is absolutely yes. It is the best health decision you can make for yourself at that moment of time to get any one of these 3 approved vaccines. Get that vaccination. It's the best health decision that you can make at that moment in time. It does not matter which one. They're all the best. They have all do a fantastic job. Nobody in the vaccine trials was hospitalized or died of COVID who received a vaccine. That's pretty amazing.
Thank you. And Dr. Newman, maybe you could talk a little bit about the Johnson & Johnson vaccine. There's a lot of people still have a lot of questions since it's new. We've talked a lot about Pfizer and Moderna over the last several weeks, giving information about how it's the type of vaccine it is, how it works, how I can't even say that today.
Efficacious.
Efficacious. They tease me here at the clinic because that is a word I can never say. Efficacious. Could you talk a little bit about the Johnson & Johnson vaccine and help our viewers understand what to expect?
Yeah, I'll start with the how efficacious it is.
Thank you.
Because I think people are getting a little hung up on that, and there's some misconceptions about that. The Johnson & Johnson vaccine works extremely well. And the primary endpoint we're all concerned about, none of us would be here, none of us would be dealing with this pandemic if there weren't the hospitalizations and death, if it was just a mild illness. But even the trials for Moderna and Pfizer versus the Johnson & Johnson vaccine, it's not an apples to apples comparison on the efficacy, because the Moderna vaccines and the Pfizer vaccines were studied earlier in the pandemic when there was less prevalence of coronavirus in the communities. And when they look at efficacy, they look at people who received placebo, who received a sort of a fake vaccine versus somebody who received the real vaccine. And over time, they follow them to see how many in the placebo arm versus in the arm that got the real vaccine develop the disease. Well, when Johnson & Johnson was being studied, there was far more disease, there was far more prevalence of COVID. So you would expect there to be a slight difference in efficacy. But that being said, the Johnson & Johnson vaccine has 66% efficacy against getting sick at all, 85% of getting significant disease, and 100% against hospitalization and death. It's an extremely good vaccine, and it has some great advantages of being a single dose. I mean, that's great. You're fully vaccinated in 2 weeks, and really receive even more. The longer you're vaccinated, you get more immunity. So that's a real good feature of this. It's very, very easy to handle. It doesn't require those ultra freezers we talked about before. So this is going to be more easily widely distributed, and it's a much more easily handled vaccine. The other advantage that it has been studied in reality against some of the new variants we've been talking about and concerned about. So it was looked at in a South African cohort, a Brazilian cohort, and it really shows good efficacy against those variants. So it really puts our mind at rest. And as Dr. McDermott showed that steep diminishment of the curve, people do talk a little bit about these variants and the concern, but I'm very optimistic. When I see that curve going down, that's really from vaccination, and that is showing that vaccine is working. We've already had some reported variants in the state, and they're not taking hold. That's my opinion, but we are not seeing this surge of new variants at this point, weeks after we've heard the first reports. So this is all very, very good news, and just really goes to show that we really need to get everybody vaccinated. Don't hesitate. This is our way out. The light at the tunnel is very close, and I'm very optimistic about the vaccination.
Can you answer if the Johnson & Johnson vaccine has similar immune response that you get from maybe the Pfizer and Moderna?
Yeah, I mean, it appears to be, they're slightly different vaccines. So, and not to get too technical, but the first 2 vaccines were really a very unique and novel new vaccine technology, which I think has just been fantastic. This is just an amazing achievement for science, really. But that's an mRNA vaccine that really, the vaccine tricks your cells into creating a protein that triggers this immune response and gives you immunity towards COVID. The Johnson & Johnson vaccine uses slightly more standard technology where it uses a adenovirus, and not COVID virus. It doesn't give you COVID. It uses an adenovirus to also give that similar information and make our cells produce that protein. So it works in a slightly different way, but both are extremely effective in creating that immune response and giving all of us the protection from COVID.
Great, thank you. Now, with our numbers going down in the community, we wanted to talk a little bit about where things are with the monoclonal antibody treatment. We're seeing fewer numbers in the hospital. Is that because of this program, or are there other things happening?
Well, first of all, the monoclonal antibody, I'm very proud that we were able to get that up and running at the height of the pandemic. Many other health systems across the country delayed because they were so stressed by COVID, but they didn't get that treatment out, and they kind of missed the window where it was going to be effective. We got that up and running immediately as soon as we had that capability, and we prevented dozens of deaths in this community by the hundreds of people we were able to give that life-saving treatment. And we prevented many, many hospitalizations. So we gave hundreds of individuals that monoclonal antibody treatment. I'm glad that we're not needing to give it. We are still infusing it, but I think that is a function of we've vaccinated a lot of our at-risk individuals in our community, and they are not getting COVID at this point. We're seeing fewer and fewer people needing to come forward and get that treatment. So I think that's a good sign at this point, but we still have that treatment available. I want to put that out there. If you do happen to get COVID and you are in one of those risk categories, please contact your physician, go to one of our urgent cares. We can give you a life-saving treatment. It's very important.
Thank you. Now, another consequence of the numbers going down, people are asking, when are we going to be able to open visitation at the hospitals? Eileen, would you be able to talk a little bit about where we stand with visitation?
Sure. We're at a yellow visitation status, and that's where we've been since early in February. And that means that we allow one visitor per hospital stay, or one visitor per day from 12 noon to 8 p.m. It's the same visitor each day during the patient's hospitalization. And certainly for different patient populations, there's some exceptions to that, and that information is on our website under our COVID visitation status. We want visitors to be in the hospital. We know that patients get better quicker. Even our healthcare workers, it's not the same not having our usual visitors here in our facilities. So we want visitors to return. And then just this week, the CDC gave some guidance about, when people can gather. But it's really important to remember that the CDC was really clear that they were talking about private gatherings, and they were talking about very small gatherings, and they were talking about people that were vaccinated. They weren't talking about healthcare settings or healthcare workers. And so while, we may be tempted, all of us have a little mask phobia. We'd all like to get rid of the masks, right? But not yet, not yet. And so it's important for us to remember that, and to understand that the CDC guidelines really talk about private gatherings, small groups, people who have been vaccinated, not healthcare workers. And the biggest reason, why we're not easing restrictions in our facilities is there's two critical patient populations in our facilities. One is our healthcare workers, and the other is the patients that we're caring for. Our facilities are safe. They're the safest places to be in our community. We've said that before, and I'm very confident and believe in that, because we're built and we're designed to have systems in place with air exchange and all sorts of things happening that create this safe environment. But our engineers are the ones that keep those complex systems working. Our IS people are the people that keep our systems and our electronic medical record working. Our clinicians, our providers, our clinical staff, our nurses take care of patients. So we need all of our healthcare workers to be here so we can take care of our community. And then for our patients, if you're sick enough to have to be in a hospital, regardless of your condition, you're vulnerable, you're sick. And so we can't let our guard down because we've got two very critical patient populations to protect here, to protect from COVID, but to protect from all communicable diseases. So I expect our facilities will be among some of the last places in our community to lessen restrictions. And it's just because of who's here. And so we want you here. We look forward to the day when we can return to usual and customary visitation at the hospitals, but it's not here yet. And so we ask your patients to work with us and to understand why the restrictions are still there. And that while the information from the CDC is very positive and is very good, and it's the first glimmer of hope that we might be able to lose the masks at some point in time, in a healthcare setting, we're not there yet.
That's a great point, Eileen. I know you referenced those CDC guidelines that I'm sure many of you saw this week, where they issued some guidelines about private situations that you might have with vaccinated individuals. And those guidelines are meant for those private small situations. They're not meant for workplaces. They're not certainly meant for healthcare workplaces like our hospital and other facilities, right, which are regulated by a whole different set of labor and industry guidelines and regulations. And so we hope someday, like if we keep up with this trend, if we get everybody vaccinated, we'll be there. We want to return our facility to what we would refer to as normal as quickly as anybody does. But the most important thing is we need to keep it safe.
Thank you, Dr. McDermott. And we are getting a lot of questions in, so I'd like to switch over to the questions we're getting from our community members. And as you suspected, we're getting questions a lot about the vaccination process and the vaccine types. So let's start with that. There are some community members who are asking a little bit about the details of getting an invitation. I got an invitation from Mary Washington Healthcare recently to schedule an appointment for a vaccine, but when I click on it, there's no appointments available. Why would that be?
Yeah, well, I know there is a lot of frustration with individuals who want to become vaccinated and have signed up for the list, waiting for their invitation. And there's a large amount of people on those lists, and we're working hard with our health department here locally to work through those lists. And unfortunately, that is not absolutely perfectly sequential. We get segments of the list to work from. The health department is working from other lists. You could imagine a situation where maybe one spouse is on one list that we're working from and another spouse is on the health department list. So it's not perfectly sequenced. And I know that leads to some frustration and questions about why, but just recognize, there are tens of thousands of individuals that have signed up with the interest to get vaccinated. That's fantastic. We need to vaccinate everybody, and we're working as diligently as we can to work through those lists. So I would say this to everybody: when you signed up with emails and telephone numbers and other contact information, is check your spam folder and junk folder, right? We know many individuals have had invitations somehow get screened by their email clients and they go into a spam or a junk folder. So I ask you to be a little diligent and check through those folders regularly and make sure you don't miss your invitation. And then, a lot of us, aren't answering phone numbers on our cell phones, maybe that ring that we don't recognize or understand. But at this point in time, I think the governor even said this, people might be calling from the list saying, we'd like to get you scheduled for your vaccine appointment. And, the more timely we are with individuals getting their appointments and get scheduled, the more efficient we can be, right? And so the more times you have to make multiple phone calls, everybody can imagine the burden that takes when we have to have 7 people call at different times the same individual till we can finally get them scheduled. So everybody can play a part. If you do sign up, check the junk folder, check your email, answer phone calls. Those are things that'll help us all be more efficient in working our way through the list as quickly as we can. And everybody's trying to do that. I mean, the good news is 2.4 million doses have been administered in Virginia. That's pretty good, right? 19% of the population of Virginia has gotten at least 1 dose. That's pretty good. We still have work to go, but we're working our way through that. And we know looking into the near future and short-term future, there's going to be more vaccine available, which is good news. So we're going to keep working those lists with our health department partners.
Thank you. And you talk a little about that timing. We do have a few questions that are coming in about how long should people expect to be on the wait list? Where are we in the list? Or how far along are we in our own community here?
Well, I think we best measure that by how many people we have vaccinated, right, in the community. And so I think there is some frustration at the state level talking about the ability to deduplicate a list. And a lot of times I know when our team is working through the list, they'll contact somebody and say, well, I've already had an opportunity to become vaccinated. And so you're working through the duplications in that way too. So it's hard to know exactly where we are on the list because it has not been perfectly deduplicated and stripped down. So all we can do is work through the list and the names as quickly as we can, contact everybody. And when you get your opportunity, please come in and get vaccinated.
And we're confidently in the middle of 1B at this point, or are we close to 1C at all?
Yeah, I think we're confidently definitely in the middle of 1B. And I know everybody, if you've seen some of the national numbers of individuals above the age of 75 and above the age of 65 that have been vaccinated, those numbers look very, very positive, right? Well above 50% of individuals have had that opportunity. And so I do know, in our state, the governor has moved what was a 1C category, those individuals 16 to 64 with kind of a complicating medical condition, moved them into 1B. And so what's left in 1C for the Commonwealth of Virginia is a few other employment areas that will be capable, and then it'll be rolling out to the broader population. So I'm sure here in the next few weeks, we're going to be rolling through that list and opening up to broader segments of the population as soon as possible.
Excellent, thank you. Dr. Newman, I'd like to pose this question to you. We've heard from people in the community who have received both doses of the vaccine, yet still contract COVID. Is this a common occurrence? What can be expected for somebody who's fully vaccinated?
No, it's not a common occurrence. What's more likely is that people have come down with COVID between the two vaccines, or are putting themselves at high risk prior to that second dose taking full effect. You have to remember, it's 2 weeks after the second dose where you're getting maximal immunity. So there have been isolated cases, but in those individuals that we've seen who've had one dose and then before their second dose come down with COVID, it's not been severe disease that we've been them seeing. So you're still getting some immunity, you're still getting some protection. But I do really ask people, once you really receive that vaccine, you should be waiting for about 2 weeks after the second dose before you should be even contemplating any of the CDC guidelines as far as visiting with others unmasked and some of those kind of things. So please be careful until you're fully vaccinated. So this is an advantage of the Johnson & Johnson vaccine, is it's a single dose, and within 2 weeks of that single dose, you have immunity. So that is a nice advantage of that vaccine.
I mean, what you described, Lisa, would not be a typical situation at all,
No.
right? And we know the data shows that, right? Look at the data, the positivity rates in our region, all of those sorts of things. That is not a typical occurrence. I have actually not even heard of an occurrence like that personally, of somebody who has been fully vaccinated with 2 doses coming down with a case of COVID. Certainly not a severe case of COVID-19.
Yeah, I would agree with that. The only cases anecdotally I'm aware of are people who within days of their first vaccine did come down with COVID, and they probably contracted it, 3 to 5 days prior. So before that vaccine, I have not been hearing of individuals either. And you have to remember, some of these vaccines are highly effective, and the data proves that.
Great, thank you. And with their efficacy, we're really not clear yet whether there's going to be a need for boosters in the future, but we are getting questions about that. Is it something where people need to be thinking about when the booster time comes, or the next shot next year? Are they going to have to get the same type of vaccine, or would there be there's a lot of that unknown and questions that we're getting on how people could be prepared for the next phase of vaccination. We're still in the very early phase of the first phase of vaccination, but is there anything we know yet about?
Yeah, so it is unknown. Even in the CDC and their latest guidance has basically said we still don't know how long these vaccines provide you immunity. We're learning that. I do know that both Pfizer and Moderna have the capabilities to create boosters that may be effective against a variant if we come to that point where there's one that we're concerned about. Again, the curves are coming way down. So the vaccines that we have are working. So there's a lot of unknowns. I think at this point we should be really focused on the fact that get your first dose of your vaccine, get your first vaccines, and then we'll see. I mean, we've all had to deal with uncertainty through this pandemic. Nobody's been able to predict this perfectly, and we have to accept that at this point. But I'm very optimistic and glad to know we have this vaccine technology. If a new variant comes out, I've been hearing within 6 weeks, could probably come up with technology to tweak the vaccine a bit to get a new booster. So there's a lot of good news. Science is winning here. The vaccine technology is really impressive, and I'm hopeful.
Great, thank you. And Dr. McDermott, I'd like to pose this to you. One of the questions here is that some of the viewers have heard that we are no longer giving the Moderna vaccine. First, is that true? And is there a problem with the vaccine? Or can we talk a little bit about how the vaccine is distributed as well?
No, we'll give any of the vaccines that we can get our hands on that get allocated to us from the state. We're not choosy, right? We're asking for as much as we can get for our community because we're confident that we can administer it in a very timely fashion. And that's really what the state is doing. They're looking at your throughput, how many vaccines can you administer, what do they have coming into the state, and they want to make sure every new vaccine that's coming into the state in a given week, they want to make sure it gets administered to citizens of Virginia as quickly as possible. They don't want it sitting on shelves. None of us want that. And so it's not that we're happy to administer the Moderna vaccine. It's fantastic. With the Johnson & Johnson, the Pfizer, they're all the best. Like I said earlier, I honestly feel that. And so we're happy to do any of those. Our allocation, recently we had a Johnson & Johnson day. I think we ran on Monday. We've had some Pfizer days coming. I don't know if Moderna is in our future or not. We are getting some Pfizer vaccine because we have the capability as a hospital and health system to do some of that storage, the ultra cold freezers and other things that we have available to us here because we're a complex hospital system and can safely store that and reconstitute it, that some other places don't have that technology to do. So if they give us the Pfizer vaccine because we have the capability to handle it better, that's fantastic. There's no issues with that, but they're all great. We're happy to get any of the vaccines that we can, and we want to get them administered to members of our community as quickly as possible.
Thank you for that explanation. A question here, I'm not sure who to pose this one to, so whoever wants to take this one, but if someone is fully vaccinated and they have some other condition like COPD or asthma that puts them at risk, should they be concerned about spending time around people who are not vaccinated?
Yes. Yeah. So, and the CDC did speak to this. So if you've been vaccinated, but you're still high risk, you should be cautious around those who've not been vaccinated. Now, you may be able to be unmasked, in a small gathering with fully vaccinated individuals, but beyond that, I would follow all the same guidelines that we've all been following. You want to continue social distancing, continue masking, and protecting yourself.
And why would that be?
The vaccines aren't 100% effective. Okay, so thus far, really, really great data, but they're not 100% effective. And if you're a very high risk individual, protect yourself. It just is common sense.
Thank you. And how long should someone wait after having a positive COVID test before receiving the vaccine?
There's some controversy around this. The number one is you already have some immunity to the virus, and the vaccine is still a scarce resource. So if you've had COVID, you've just recently recovered, you may want to let somebody else get the vaccine ahead of you. I really do think in the next few months we're going to have enough vaccine for everyone. So it's not urgent for you to get vaccinated, but certainly it is safe for you to get vaccinated in that 14 to 30 day period. Probably that is probably safe. But again, it really is when we have a scarce resource and you already have natural immunity, you may want to let somebody else who doesn't get the vaccine.
And if there are people who are 65 or older in our community, but haven't heard one way or another from anyone about getting a vaccine, should they be concerned that they're still on the waiting list? Are we still getting lists of 65 plus people from the health department?
Oh yeah,
we're still working that list, and I believe there's a way now on the Vaccinate Virginia website. You can go on and check to make sure that you're still registered and on the list. So I would encourage them to do that, to go to vaccinate.virginia.gov and check your status on the list. But yeah, I think we are still working through the list of individuals, including those age 65 and above, trying to get to everybody as quickly as we can and vaccinate everybody as quickly as we can here in our community.
And we certainly want to continue to encourage those who are watching to share with others. Check your spam folder, check your junk mail. If you gave us an email, we're likely reaching out to you by email, but also answer your phone call if you see something from Mary Washington Healthcare, because we could be calling you as well. We are getting a lot of love and shout outs about our operation at the Fix Center. So that's always exciting to see. But people are asking, how do I get on the list? Can we just say one more time how I get on the list if I haven't been on it before?
Well, the vaccinate.virginia.gov is the site that you go to sign up for the list, and you put in your information there. And then our local health district will be getting distributions of that list for our community. And those are the lists that we, in partnership with the health district, work from to get individuals in our community that have registered that they're interested in becoming vaccinated. We work from those lists to vaccinate those individuals. And so that's this is the information right there that you need to use to get to say that I'm interested in becoming vaccinated. And then as quickly as we can, we're working through the list. That's for sure. You mentioned our vaccine clinic and the operation up there. We've gotten a tremendous amount of positive feedback from our community. And so we're very thankful for that. I'm also, I'm proud of the team and what we've done. We're one of the highest throughput vaccination centers in the Commonwealth of Virginia, what we're doing at our Fix Center. We see that data. And so that's a great thing for our community. And I can't be prouder of the team of what they've built and what they're doing every single day here to vaccinate our community and get it done quickly and safely.
That's great. Thank you. And one of our viewers is asking, Dr. Newman, you mentioned that there's some level of immunity that somebody gets after having a positive case of COVID. What does that look like? What level of immunity what does that mean?
The only negative thing I can say is that we have found that with some of the new variants, which we're not seeing a ton of at this point, but some of the new variants, it does not provide adequate immunity for that. But general 3 to 6 months, I think you could expect a reasonable amount of immunity. There have been reinfections, and in fact, when there is a reinfection, we do study those to see if there's a potential for to be a variant through the Department of Health and the state lab. But in general, if you've had recent COVID, it would be highly unlikely for you to get reinfected, right away and not have some immunity to that.
Thank you. And can we talk a little about side effects? We're getting questions about the side effects, as people call them. I like to call them the immune response, because it's not really a side effect as much as your immune system responding to it. Of the 3 different vaccines, are they the same? Are they different? How would one expect to react?
Yeah, so as I spoke before with the Moderna and the Pfizer vaccine, the side effect profile, that immune response profile is very, very similar in both of those. And about 25% of individuals do have a robust immune reaction to the second dose, most likely. So, and that would be fever, chills, those kind of almost like flu-like symptoms that can last for a few hours to a day, and then fatigue that could last up to a couple days. Again, that is not an adverse reaction. That is just your immune response revving up. I have heard anecdotally that the Johnson & Johnson vaccine has less of that. When you look at the studies, they do still report some of the fever, chills, body aches in similar percentages. But that being said, what I'm hearing anecdotally is it's very similar to what people experience after the first dose of the Pfizer and Moderna vaccine, which is much less significant. We've only had 1 day here, so in practice, here we'll see what we're finding out here locally. But the symptoms and the side effects are all very similar. It's all that immune response that roughly a quarter of people are getting.
And if someone has tested positive for COVID, do they have a stronger reaction to the vaccine? Is it their body is recognizing the vaccine and doing its job, or is that not really been found?
I don't know that it's been found or correlated. I've heard anecdotally that as well, but I wouldn't really say that that's been looked at in any formal fashion.
Thank you. Some folks have been asking to switch back to how vaccination invitations get put out, that they've heard that there are sometimes people who are younger than 65 getting vaccines and people who are older than 65 getting vaccines. How exactly are people getting invited? Is it random? What is the process?
Again, it's the list that we're receiving from the Rappahannock Area Health District of individuals who are eligible to be vaccinated. And the governor has designated that we are currently in the 1B category. And that includes individuals 65 and older, a certain number of essential occupations that have been listed. And then also individuals 16 to 64 who have kind of complicating medical conditions that place them at high risk if they should get COVID-19 and come down with that. And so all of those individuals are eligible, and those are the lists that we're working from. So it will be a combination of individuals 65 and older, individuals in those occupations, and individuals 16 to 64 that have complicating medical conditions. All of those individuals are eligible, and those are the names that we're working from on the list that are currently in the 1B grouping that we're working from.
Thank you. And can we talk a little, we're getting some questions about the CDC guidelines. We've referenced these a couple of times, but haven't really talked to them specifically. Can we talk about what the CDC did come out with, the recommendations for those who have been vaccinated?
Yeah, so you can gather in a small group. If everyone is vaccinated, you can gather unmasked indoors in a small group. Okay, so that's something new, and that's something really shows that there's optimism and the data is looking good on these vaccines. You can gather in a group unmasked if individuals are vaccinated with one other household that's unvaccinated, as long as those individuals are low risk if they develop COVID of having severe disease. And I'll say the prime example of this is grandparents who are vaccinated coming to visit their grandchildren for the first time. And of course, we can't vaccinate grandchildren at this point. So if those grandchildren are well, then that is okay as long as it's one household. Another point that shows that the vaccines are working is if you're exposed to COVID and you're fully vaccinated, you don't have to do a 14-day quarantine anymore. That is not recommended. Certainly, if you have any symptoms or signs of COVID, you need to isolate yourself and get tested, but otherwise you do not need to follow that quarantine. What the CDC said that vaccinated individuals need to continue to do is mask in public, continuing to social distance in public, all the same sort of things. They are still not recommending broad travel because again, travel is one of those ways where the virus can spread and it's a vector. They're not recommending medium to large size gatherings. So that's another important point. But this is all optimistic. We're cautiously opening up and proceeding, and we're following the data. And as the data looks better and better on these vaccines, the CDC will continue to make recommendations accordingly. The one thing that we talked about previously that is looking good is we weren't sure about spread. You've been vaccinated. Could you be asymptomatic and spread to others? The data on that is starting to look better, that the answer is no. We're not definitive on that. So we're still masking everyone. And from a practicality standpoint, you have to remember, you're not holding up a card, you're not wearing a hat that says I've been vaccinated. So from a practicality standpoint, there's no way to say who's vaccinated and not when we're out in public, when we're shopping at a Target, so we all need to be respectful of each other. We all need to be protective of each other and wear a mask. Really, the end is in sight. I really do feel that the data is showing that. This pandemic continues to throw us curveballs, so I'm not going to hang my hat on that, but I'm really optimistic at what we're seeing.
Thank you. And with anybody who has been vaccinated, is there anything they need to do to know how well the vaccine worked for them? Should they be getting an antibody test or anything else?
No, in fact, they should not be getting an antibody test because it may not turn up positive because the commercially available antibody tests don't test the same antibodies that you may develop that provide you immunity from the vaccine. So that is something that we learned here a few weeks ago with an individual that was concerned in that regard, and we did talk to some laboratory experts on this. So you do not need to get checked. You don't need to be confirmed. Really, you wait the 2 weeks after your second dose if you get one of the Pfizer or Moderna vaccines, or 2 weeks after the single dose of the Johnson & Johnson, and you can assume that you have full immunity. And these vaccines have great efficacy.
Thank you. And one last question from the community is, where are things stand with children and receiving the vaccine? Are they testing this actively for children?
Yeah, so we're very lucky to have members of Children's National medical staff that practice full-time here in Fredericksburg in our community. And I did have the ability to talk to some of them, and those trials are ongoing in children. They're starting to look at this, and really just a ballpark estimation would probably be next year. I do know that they are starting to vaccinate some high-risk children that they're concerned about with the immunosuppression. And that certainly is under the guidance of pediatric specialty experts. But the trials are ongoing, and they're anticipating sometime next year. And the safety is looking good and anticipated to be good for children as well.
And we did have one last question kind of pop in here while we were talking. If a medium to high risk person contracts COVID after being vaccinated, would they be eligible to receive the monoclonal antibody treatment?
I don't know the answer to that, quite honestly. I do not know. That is something we'd have to look up as a special case. That is not something we've come across yet. My suspicion is no, but we would have to really look at the specifics on that.
Great. Well, thank you. And I know, Dr. McDermott, you had a shout out that you'd like to provide this evening to close us out for those that are working in our clinic.
Yeah, a couple of things I just wanted to mention. We've talked a lot about hope and optimism here, and I think we all sense that. And we showed the curves earlier and the trend lines, which are very fantastic. But a couple of other anecdotes I just wanted to share with people that have been unusual for us. And one of those is, when we have patients here that we've been treating with COVID-19 in our hospitals, and so there's always a certain amount of test results that we're awaiting to come back. Is a patient positive for COVID or not? And since way back in the spring, we've always had patients where we're awaiting test results. Well, there was a moment in time last week where we didn't have any pending test results on inpatients, right? And it's the first time in the pandemic. It's like, oh my gosh, wait, we're not pending any test results. Like, we know the answer for everybody who's in our hospital. That was unusual, right? And that's a good sign. Similarly, there was an anecdote from one of our emergency room physicians saying at one of our ERs in a 24-hour period, they didn't have any patients come in who were symptomatic for COVID. And that's the first 24-hour period at one of our ERs where they didn't have any patients present with symptoms of COVID, dating all the way back to the spring. Those are good signs, right? And so there is a sense for optimism here, but we need to stick with it. We need to, if not everybody is vaccinated yet, and so we need to keep up with our tactics, social distance, wear masks, do the things that we know can help, and get vaccinated when you do have the opportunity. These vaccines are fantastic, and they are our way out here. So when you do get the opportunity, please get vaccinated and protect yourself. Our vaccination clinic has been running amazingly efficiently. Can't be any prouder of the team of what we've done and we're doing for our community every single day at our vaccine clinic. But it takes a village, right? It's a combination of our employed associates who are putting in extra hours working there at our vaccine clinic, but there's also a large segment of volunteers from our community that are helping us operationalize our vaccine clinic every single day. And you can imagine we're leaning on those individuals that have volunteered and asking them to make commitments to us to work multiple shifts in a week, because it takes training to learn one of the positions in our vaccine clinic. And when you become trained and efficient at it, you can help us with our efficiency of our clinic. So we're leaning on them and asking them, like, hey, for those of you who, it doesn't do us very good if we have to train somebody new every day, but those who have been trained, can they commit time to us and really help us run our vaccine clinic efficiently? And so many members of our community are volunteering significant amounts of their time to help us run our clinic as efficiently as it is. And I know you said there's been a lot of feedback in the chat about it, and I'm sure there is, because I can't be prouder of how efficient we're vaccinating our community with our fixed center vaccination clinic. So I want to just say a big thank you to all of those members of our community that are volunteering all of that time. You are making a difference for our community, helping us emerge from this pandemic, right? And I'm inspired by all of the time that you're giving. I admire it. And I want to just thank you on behalf of our community for your commitment and what you're doing to help us emerge from the pandemic. Thank you, all of the volunteers operationalizing our FIC vaccine clinic. Thank you.
And we actually have a little video we'd like to share talking about what it takes to put together that clinic.
Of the whole year of the pandemic, the vaccine clinic kind of represented, in my estimation, kind of the pinnacle of the organization coming together and really responding after having such a difficult year that we all have had together. When the vaccine finally came out and there was hope, the collective sharing of hope among all the associates, the willingness to volunteer, and then putting logistics in place, which were not a small task, to a place where we subsequently were seeing and able to vaccinate over 2,000 people in a day was unbelievable.
One of the things that I have found to be so impressive about our organization throughout all of our COVID journey has been the way we've pulled together and really pulled on our resources from within the organization so heavily and brought these multidisciplinary teams together so that we're bringing in people's different ideas, different thoughts, and really pulling it together.
Our job for the COVID clinic is make sure that as people come onto the campus, they have directional signs to get them to that one entrance to get into the clinic parking lot. I think when we first started the COVID vaccine clinic, we might have had, 8 directional signs around the perimeter. I think we had maybe 10 traffic cones and maybe 20 reserved parking spots. And that was it. We had people self-park, they'd walk up to the clinic, check in, walk back to the car, and wait for that second text. We realized pretty quick that wasn't working. So we put a tent up, we had the check-in persons out in the tent. That way people could drive up, check in, go park, and wait for the second text. That way they never left their car. They were very comfortable in that situation.
We're always looking for what is the piece of the puzzle that isn't fitting at that moment, and we're just kind of running towards that fire and trying to figure out how we can change it in order to have things run smoothly. We see, those small details that we're like, oh, that could be better. What do we do here to make that a little bit better for next week or for the next day?
It was incredibly smooth. And the efficiency of it has been compared to Chick-fil-A, and it really is. It's just dynamite. Everybody who comes says, they're throwing the best party in town, because you go and you haven't been out and you haven't been around people and you see people and these wonderful people who have worked all day at the hospital and show up to volunteer that night. So it was all in all not just a very smooth operation, it was a pleasant experience.
I was one of the community members that was donating to food banks, sewing masks, and doing whatever we could, but it just felt like with the skill set of still having my nursing license, gosh, I'd love to be hands-on again if needed. And fortunately, someone reached out and asked if I would like to be involved with a vaccination clinic. And so my husband and I have been involved from the start, and my daughter volunteering as well.
My wife, she's clinical, and she's involved on the clinical side of that. That's not me, but I threw my hat in, and I knew as soon as they started standing up the clinic that there would be a lot of logistics and just needing people to get people moved through the process. The best part of the working in the tent is you're kind of the first person they see. Watching the people pulling away from the tent with a smile on their face. It happens a lot. There's a lot of crying. People are so excited to be there. Being able to greet them, help them through what the process is going to be, and then walk away or drive away with a smile on their face. You know that this whole team is making a difference to people's lives.
The outpouring of generosity, both of time, talent, and treasure from our community has been enormous. It has really just been a huge, heartwarming effort.
I had a wonderful career here. Started out as a nursing supervisor and worked my way through to having the great opportunity to be involved with performance improvement projects like the hospital move. from a performance standpoint, as it relates to the pandemic response from the health system, it has been so impressive from start to finish. It really encourages you with all the young leaders that have been involved with the planning of the vaccine clinic and the quality execution they've done.
Having been here for over 30 years, it's been a profound privilege to work with everyone during this year. Every person was valuable no matter what they were doing, and it reflected what we've been doing for the last year on a more focused scale, that we were able to deliver these vaccines.
The organization's commitment to our community is amazing. You know, to put this much effort and resources towards really improving the health of our community just really speaks to our culture and our mission, and I'm proud to be a part of that.
That's a fantastic video and a great testimonial to all the hard work that's going on at our Fix Center. And I just look forward to every member of our community getting an opportunity to experience it and protect themselves and get vaccinated at our Fix Center clinic.
I agree. And I hope to see everybody here and we'll smile and wave and cry with you when you get excited about your vaccine. So thank you to all of our panelists tonight. Again, another great town hall, and we appreciate your time. And thank you to all of our viewers for tuning in and watching our community town hall. Hopefully you've learned some great things tonight and have some optimism and excitement for our future. Of course, if you're having any kind of symptom and not sure where to seek care, we do still have our HealthLink free triage line available to you daily from 6 a.m. to midnight. So please call our great nurses there at the number on the screen if you're having symptoms and need some care advice. In the meantime, we also would like you to tune into our Facebook page and other social media to stay informed with the latest information of what may be happening in our community. And thank you for tuning in. Please stay safe and healthy and have a good night.